This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning, and of course, happy Mother's Day. We got to get that out there right away. You know,
John,
good to have you with us as always. And speaking of Mother's Day, we have a Mother's Day theme show today, Dr. Molly. So
we sure do.
You know, we're really right in there with it. Okay.
I agree.
As we are here every Sunday, 8 till 9, Talk Radio 1210 WPHT. What we talk about here on the show, of course, health. That's the clue in the title. But specifically you and your family, and how Dr. Molly and her team at Innovative Medical Associates can help you improve your quality of life. And that's really our mission statement here on the show. And as always, we are live in the studio. 855-839-1210 is the number. If you have a question for Dr. Molly, 855-839-1210. And, of course, that's, as I said, at any time during the course of the show, if you want to call in, feel free to do that, 855-839-1210. Yes, happy Mother's Day. We got that out there.
Sure. Happy Mother's Day to all the mothers in our clinic. When we have a sizable number of women patients. And, John, in many cultures, it's not just the children who are your children naturally. You can be mothers to many women are mothers to a lot of other children, godmothers, aunts, good friends. I mean, and a woman's touch is always welcome.
Well, you're a godmother, and I'm a
you
godfather.
You and I talked about that a lot, and not just because we're Italian.
That's right, exactly
Okay.
right. Right. I guess it's the extended mother family is what you're talking about.
I'm saying it's a happy Mother's Day to all women out there, because in one way or another, many women are mothering many people. It is, and thank God.
And we're going to focus on women's health today on the show. But
sure.
I wanted to ask you, normally we talk about Innovative Medical, what
Sure.
you do and how it's different. And let's, for the moment, focus on women. What do you do differently? In other words, the overall theme in general for women as far as Innovative Medical is concerned.
Well, the overall theme is, of course, we can do anything any primary care facility can do. My docs can prescribe, so if women need a particular pharmaceutical, we can prescribe for that. But again, what we like to look at is utilizing natural substances by hydration to deliver an appropriate amount. In this case, we're talking about women, which is a little bit more complex, believe it or not, than men because of the hormonal issues, but delivering an appropriate amount of the nutraceuticals to effectuate the change that the doctor is looking for and to improve quality of life.
In terms of, and we will talk about this extensively today, but in terms of women versus men.
Yeah, well, now we don't like to say versus.
I know. Well,
Yeah.
as opposed to how you treat men.
Sure.
In other words, there's more going on with women, so
Absolutely.
it can be more comprehensive and complicated.
Absolutely. And of course, we look at that because the hormonal cascade, we talk about men's health every week in one way or another, and we talk about men and low T. Well, women have a combination of hormones, just like everyone does, men and women. But in this case, it's the actual relationship between all those hormones that also can affect women's health. And as you know, or maybe folks don't know, in America, the number one killer of women is heart disease.
Yeah, I
Still,
knew that.
Even though we focus a lot on breast cancer, and believe me, I have my share of women's cancers. Patients in our clinic for the cancer supportive treatments. But beyond that, heart disease is the number one killer. And most women, believe it or not, between 40 and 60 have at least one factor for heart disease and a higher risk factors for stroke. So obviously, women's health is very important. And I urge all of our women to go to their gynecologist, their endocrinologist, those kinds of issues, in addition to coming to see us.
People don't think about that, and you always think heart, you think men.
Exactly.
And here it is that and it has been the number one killer for
Probably
women
for 20 years.
At least 20
years.
Yes.
You and I, every time Heart Month comes up, I think about it and say, women are undertreated many times because, again, cardiac issues are so unique and affected by hormonal issues. It can be quite challenging to make the diagnosis, and a lot of physicians, they take women's issues sort of cavalierly.
And that's something that we always talk about, is that not that they take it cavalier, but the issue
they can
is
dismiss it much
they
more
can
quickly.
Right, because in their mind too,
It's
the perception is
it's menopause. That's right.
Whatever, and
That's
it's men's issues,
Correct.
So that's
Correct.
men have a lot of stress and they're high-powered jobs and so on and so
guess
forth.
what? All that's changing. So and does hydration help that? You bet. You know what helps that? Chelation
That's
therapy.
right. That's
and
right.
I have a fair amount of women who are taking chelation therapy.
And let's just touch for a moment, because we're doing it a little differently than we normally do today. Let's just touch on chelation.
Sure.
And what that does in terms of what you're talking about with women.
And heart disease.
And
sure.
heart disease. What does chelation do?
Chelation can improve blood flow 12.5%, 12% on the entire body surface. That's a big number when you look at your body and you look at, height, weight, etc. So we can then improve cardiac output using some cardiac nutrition, carefully looking at improving overall circulation. And that's really the idea. But that is done through hydration using EDTA and, again, the cardiac nutrition. And sometimes I tweak the cardiac nutrition depending on what the docs and I talk about. And we talk about it all the time. And depending on what we think the patients can tolerate, etc. So bottom line is, chelation is the overall, in our facility, a protocol that we use to help in terms of cardiac issues and also in terms of inflammation.
You remember your original doctor?
I do.
He used to call it liquid plumber.
That's right. That's right. Technically, that's not quite right, but he was right to put it out that way because it really is. You're putting in substances that combine with the free-floating calcium, open up the vessels and that kind of thing. And, there's been in 20 years, John, I've seen such a change in chelation and actually the way we do it, the way we've done it, and the way the protocols are set out in our clinic. I believe we are using the best products out there, a lot of God's ingredients products to, again, help the cardiac output for most patients. And, the results are in the pudding.
It's interesting that when we first started doing radio shows like this, you and I talked about chelation all the time. And you had so many examples of people that had bypasses.
I know.
And I remember the one patient, and where your office was at that time, there was a little walkway to go to your door.
That's right.
And he couldn't make the walkway.
And I'm going to tell you, he lived to the ripe old age of 90.
Wow.
I heard from his daughter who actually thanked us for everything we did for him. Isn't that unbelievable?
Yeah, and I remember it like it was yesterday.
It was 20 years ago.
Because I said, how could you not walk from where you're let off? You had like a little circle there.
Yeah, it was
a
cul-de-sac.
car could drop you off, but you didn't need that because you really weren't far from the parking lot.
Right.
So that's what really blew me away.
It was quite a case, and and actually combing through our old files. I'm amazed at how many people we helped improve their cardiac status. It was amazing. And
it was like pretty much in the beginning, that was really all you did. I mean,
exactly.
It was.
That's how we cut our teeth,
right.
I like to say. And that was probably the only way. So we were a little ahead of the curve at that time. But I knew even back then it was necessary to continue to research and look at what other nutraceuticals and how we could apply them to the chelation to improve certain systems within the body. And that really was the key. And also to look at global inflammation, not just the cardiac inflammation. And that's true for men and women.
And that's what we're talking about here today. In light of the fact that it is Mother's Day, we thought we'd focus the show on women's health. And interesting, Dr. Molly, looking back over her notes, you I've had a women's health program for the last 24 years.
Yeah,
And
it's just
like,
that we don't really talk about it. And, it's something that we should. And I think the wonderful thing is I have a wonderful physician who started with us about a month or so ago, and she's been very helpful in re-energizing that program because, you look at endocrine disorders in women, particularly thyroid and those kinds of issues. And although we of course, have all of this information in our toolbox. We have the nutraceuticals, et cetera, for that. Many times, I'm so busy, I overlook the fact that this is something we have been doing, and now we can even do it better.
Speaking of busy, boy, the other day you were...
Yeah, it seems like our Tuesdays and Thursdays are the highlight.
Standing room only.
Yeah. It seems like Tuesdays and Thursdays are the highlight of our week. So listen, folks, if you want to come in for a free consult or something, make it Monday and Wednesday, and we can spend more time with you. Although, you know what they do. They yank me out of those consults.
That's right. That's right. We're coming up on our first break of the morning. Our show is called Health Watch. We're here every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And as always, we tell you, look, if you want to call in, you can call in any time, but early is better because we have plenty of time to talk to you. And we don't want to shut out people from not getting in here on the air because, the show is over. 855-839-1210 is the number. 855-839-1210 with Dr. Molly Fantasia. I'm your host, John DeMasi. More Health Watch after these words. We are back here on Health Watch. Don't forget, operator standing by right now at Innovative Medical Associates. And the number is 856-489-0505. That's 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. You call them and you want to make an appointment with Dr. Molly. The initial consultation is complimentary. Or if you have some questions, you want more information, they'll be happy to provide that for you. Again, 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. You get a lot of information on that as well. Right now, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. And again, the number here, you have a question for Dr. Molly right now, 855-839-1210. A good gift, Dr. Molly, for Mother's Day is to give Mom a course of chelation.
I agree with
that. Or hydration, or whatever you want to...
I agree with that. It's the kind of gift that truly can help your mother's quality of life.
And over the years, certainly you're faced with some challenges, so this may help.
Yeah, it's true, John. But again, I think this show dedicated to women is a good thing because I think people don't realize there are some conditions that are more common in women than men. We just touched on one, the heart disease. But you'd be surprised how many autoimmune disorders affect more women than men.
Let's talk for a moment. You mentioned earlier heart disease is the number one killer for women, and you said women between the ages of, 40
and 60
have at least one risk factor for heart attack and stroke.
Yes.
So can you tell us, what are indicators that there's a problem?
Right. Well, first of all, you see, because of the hormonal balances in women, they are very complex. And here's the thing. Hormonal issues are affected by the mitochondria of certain cell systems. Think about that. Just think about that. And it has to do with receptors and this and that. I don't want to get into that because it's like a whole biochemistry and molecular biology course. And I don't want to do that. But I want to say that many diseases are affected. Women are more affected because of the hormonal issues. So one of the things we see has to do with cholesterol. Many times women have hypercholesteremia. That's one of the conditions. Also, women have something that called, and men do too. I'm not saying this is exclusively women's diseases, by the way. I'm saying that if you did the statistical analysis that's done from the Department of Health and Human Services,
here we go.
They've dedicated a whole they've dedicated a whole wing to just women's conditions and things that affect them. So another thing is antiphospholipid syndrome, and that's an autoimmune disease that causes blood clots in the arteries and the veins. So it has to do with a certain syndrome in terms of biochemically that affect more women than men. And if you hear anything about estrogens and blood clotting, you can see there's a relationship, right? That's
Yes.
why they worry about young women on birth control pills. So all of these things have a relationship and can cause more harm, or they're more likely in women than men.
What can women do, particularly in light of what you're saying here today, and maybe some didn't know that? What can they do besides, of course, chelation and your hydration therapies? But what else can they do to lead a healthier life and to try to prevent this kind of thing?
Listen, we all know that a lot of this has to do with lifestyle, right? We have to look at all autoimmune disorders, whether men and women. So we got to change our lifestyle, what we eat, processed foods. How about xenoestrogens, estrogens that are out there that are really the body processes certain substances, whether environmental or sometimes it's the fillers in medication or foods that the body actually thinks of it as an estrogen and processes it accordingly. So therefore you get estrogen dominance. So yeah, you got to really change your lifestyle, the outside stuff we do. But in addition, a short course or a course of hydration therapy utilizing certain nutraceuticals that can improve the mitochondria function would be a very good way to help hold this kind of problem down.
I know you've said this before, but for those who haven't heard it, when you say mitochondria, what do you mean by that?
The powerhouse of the cells. That is the little soldier of the cells that keep us all going. And again, the mitochondria is different in each and every cell type. So again, you have to look at what's being affected, what part of the body's being affected. So, for example, women can have alopecia areata, right? Well, what is that? The immune system isn't up to par, and it's attacking the hair follicles or the structure from which the hair grows. It doesn't threaten health, but it certainly makes women very uncomfortable, right?
Yes.
Because we always talk about male pattern baldness, but we don't really pay attention to this. And I have several women right now who are in my chair, so to speak, who have this problem. So it is something to behold. So why wouldn't you want to improve what? Your autoimmune. Why wouldn't you want to improve your immune system? It always goes back to the immune system, John.
I know. And again, it's the same thing as heart disease. Oh, you think it's men because they got stress and all this.
No, but there's another one. That's why I mentioned it, right? So women suffer from that. You know what else is interesting? Women suffer a little more statistically from GI tract problems. Isn't that interesting? Now, you know that's true, right? Irritable bowel, that kind of thing. Now, men suffer too, don't misunderstand me, but celiac disease is something, right? The abnormal bloating and pain. Well, many times that is missed because we think, oh, it's just menopause or hormonally related, and it is. It actually is, because there's an estrogen issue there as well as your immune system. So here we go. We've got to really look, again, going back to what? The basics. If we don't have a strong immune system, forget about it, folks.
That's right.
Forget about it.
Yeah. So the thing is with women, there's more going on with women than men, obviously.
Right.
But they've got, it seems like women have to pay more attention to certain things and the overall health.
Here's the thing. You need support of the mitochondria during your lifetime, no matter what. But I think you need more of it during hormonal therapy. That's why our bioidentical hormone therapy for women includes a course of hydration therapy, because without tuning up the mitochondria, for example, we don't necessarily do the patient a favor. In other words, yeah, it's easy. People, I have a lot of women who come into me and say, oh, I get the pellets. Great. It's a great thing. We know about this. If you've heard about pellets, it's where they insert things like for birth control. And they also are using this today for to relieve some of the symptoms of menopause. Okay, I can live with that. But if you don't tune up your mitochondria, how effective do you think your hormonal replacement might be? Maybe not effective at all, because there are other systems affected during menopause.
It's complicated.
It's very complicated.
That's what listening to you, yeah, it is.
John, all hormones originate in the mitochondria. Let's make it simple. Keep it simple, stupid. All hormones in various organs, various cell systems originate in the mitochondria of your cell. And for the last year, you've heard me talk about your mitochondria.
That's right.
That's the key. So in our facility, our physicians look at your overall condition. We don't just look at the endocrine disruption in and of itself. What we look at is what's going on. Why did this happen? And invariably, it's going to go back to some type of mitochondria dysfunction. And so what we need to do is look at that. We need to look at that.
All right, we're coming up on our halfway point of the show, coming up on our break here. And if you have a question for Dr. Molly, of course, we're focusing on women's health today in honor of Mother's Day. 855-839-1210 is our number, and we always tell you call in early so you make sure you get in. And this is a good time. We do have some open lines, so if you want to call in, 855-839-1210 is the number here in the studio. The show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. Welcome back to Health Watch. Operator standing by right now at Innovative Medical Associates. And as always, when we're here on the radio, you can call them during the show. Get more information or make an appointment to sit down with Dr. Molly. The initial consultation, of course, is complimentary. 856-489-0505. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we should also remind you that if you miss any of the show today, I know it's Mother's Day, maybe you went out to early breakfast or you're sleeping in. You want to catch us later on today, it's our Health Watch replay 4 until 5 every Sunday here on Talk Radio 1210 WPHT. Right now, though, you can call in at 855-839-1210, 855-839-1210. We are focusing on women's health today in honor of Mother's Day, and talked a lot so far, a lot of information. And Dr. Molly, signs that your hormones are out of balance. Now, what does that have to do with everything we've been talking about here?
Well, it has to do with everything we're talking about when you think about mitochondria health. So one of the things is fatigue, hair loss, right? Maybe you have some blood sugar irregularity. How about lack of drive? That's good for men and women, right? Why? Testosterone is important for women too.
Yes.
So there are many sort of obscure symptoms that the doc has to look at and say, what's really the underlying cause. But lots of our perimenopausal, or that's premenopausal women, come into us and have a multitude of these symptoms. And again, it's a question of not just saying, oh, well, let's stick them on some estrogen therapy. No, we want to do blood work. We want to look at the inflammation, the global inflammation, because that's very important. And we know that hormones have some regulatory effect on global inflammation. The other thing is these symptoms, again, as I say, can be mild or they can be more severe. And a lot of that's going to depend on a good clinical picture that our docs are going to get to us, And for example, we do bioidentical hormones for women just the way we do it for men. But part of that protocol will include what I spoke about earlier, the blood work, looking at mitochondria response, making sure that there isn't something that the physicians have missed, which is unlikely because we're pretty thorough, and then we'll give you the hormone replacement. But we want to do that very, very carefully because, as I said before, men are so much easier. Replace that testosterone, and boy, what a change. What a change. Women, it's a little more subtle. And it takes some time, and it takes a lot of data that the woman has to come back and give us. So that's why we like to use the hydration therapy with this so that we can improve the immune system, and maybe we can reduce some of the estrogens that we have to give women, and also then keep them out of harm's way from the bad estrogen response, which is estrogen overload.
Okay, you mentioned estrogen, bad estrogen, good estrogen.
Yeah, there are 3 estrogens,
Okay,
that's why.
okay.
Heavy-lated estrogen. See, again, listen, guys, you are so lucky. Testosterone, here it is, right?
Yeah.
Bioidentical testosterone. It works, and it works pretty quickly. Within a month, you start to see the changes. Women, a little more subtle.
Is that why women always say men have it so easy?
I don't know. I don't know if men have it easy, but I know women have it difficult. Okay.
Explain, if you can, Dr. Molly, when you're talking about bioidentical hormones,
Okay.
where does this come into play? When do you do this?
Well, when women come into us with these menopausal issues, obviously, lots of times, actually, most women patients who come into us are seeking bioidentical hormones. They know all about it. They've done their research. They know. The question is, these are substances, make no mistake about this, they are engineered in a lab, meaning in a compounding pharmacy lab, and they are engineered to go onto the receptors and to fit like a lock and key on women's receptors. So, that being said, truly, I guess, bioidentical is the appropriate term. They are not natural. You can go to the health food store and pick up, quote unquote, natural progesterone, right? You can go there and you'll see a tub that says progesterone, and it'll say from yam. Well, let me ask you a question. Do you think the yam is the same size as a woman? No. So obviously, yeah, it contains a high level of progesterone, but until that is bioengineered in the lab, it's extracted. Our estrogen that we give bioidentical is extracted possibly from yam and other products. They also use some soy-based products. Guess what? It's not the same size as that's circulating through your body. So it has to be changed to do so. So that's where you need a good relationship with a great, compounding pharmacy. And I use 2, and I know them, and I trust them. I trust them with my own hormone therapies. And I can tell you that I've seen their lab. I know how it's prepared. I get the catalyst that they use, which is the thing that changes a compound. And this is what I'm saying. It's not so simple to go into the health food store and pick it up.
It sounds like what you've always said about health food stores. You can go in there,
right.
You can go in there and get it. It's not the same as what you're offering with hydration.
No.
And also it's not as potent.
That's right.
So,
it may not be.
Same thing.
It may not be. It isn't even a question of potency. It's a question of appropriateness. What's appropriate for you or for me may be different from Jane and Harry somewhere else. And that's where we differ. And that's the point. Same thing with some of these conditions. So we have to be very careful, because estrogen is responsible for weight gain. So we've got to look. Too much estrogen increases the risk of breast cancer, ovarian and endometrial cancer. So guess what? We want to handle that very appropriately. That's another reason to come in and see us for the hydration. We get to see you once a week, and then afterwards we can do it once every 3 months. But believe me, we're going to follow you closely.
How do you know you have too much estrogen? What's a sign?
Weight gain. Weight gain is one of them, right? And you can look at, you may have tender breasts. I mean, there's so many things. And other thing is, you got to look at whether you're still fatigued and all of the other issues. Now, in terms of the weight gain, that's very interesting because, again, what you want to do is look at the other hormones too. As I said before, thyroid, something one of my docs is a specialist in, meaning she's not an endocrinologist, but she is a very, very aware of the problems that thyroid disorders can give women. And so it's important to rule out the thyroid issues or to augment the thyroid while you're on the estrogens. So you can see this is a complex issue.
Yeah.
That's why it doesn't take a 10-minute visit. Okay.
Okay. It takes multiple visits, I guess.
Well, no. Initially, we can do an overall visit, but it's a comprehensive visit. And what will happen is after the dosing, we try to make the dosing as appropriate as possible based on the laboratory plus the clinical. We may have to change that. That's why we want to follow women very carefully, at least once a month.
There's so much going on here.
Yes.
And it's like you really can't let it go because
No.
but listening to you and all these things that can possibly happen, you just got to really stay on top of it. And
You
you said to me
believe
before
it.
the show, stay on top of your health.
Honestly,
Yeah.
it is so important that women realize that you just don't pop a pill, just the same as when we're young women and we're worried about our birth control options. Obviously, you want to make sure you do the regular, and when I say regular, I'm talking about conventional medicine. Here we go again about conventional medicine. I want you to get your mammogram. I want you to get your pap test. I want you to go to the gynecologist. I want you, though, to make sure you take charge of your own health. That's the important piece. Yes, you use your physician the way you would use your doctor, your lawyers, and your accountants. They are your consultants. Yes, they are the experts. But you know what? You use your own intuitive nature to say, okay, I don't like what he's saying. Let's get another opinion. Talk to us. One thing about my docs and I, we're readily available to talk and help patients through and also secure second opinions for our patients, definitely.
It sounds like what you told me before the show. Because
Yes.
I'm getting a stress test tomorrow, and
Yeah.
you said to me, "Okay, here's what you got to do.
Yeah.
You got to take You got to take control of your own health."
Exactly.
And that's exactly what you
and I
said.
will tell you, John, you're doing so much better than many men with your history. And you know that yourself.
Yeah, right.
And so am I open for you to get this? Sure, it's a conventional test. We should have the data. But again, you're not in an acute situation, and that's the best way to go and do these things.
Right. So that's what you were telling me.
Yeah,
just
that's the bottom line.
make
Be
sure
in
you
control.
take control of your
That's
health.
it. That's it.
We are coming up on our final break of the morning, which means you still have time to jump in here with a question or a thought for Dr. Molly. You have a medical challenge you want to run by her. And if you want to just call in and say Happy Mother's Day, whatever. 855-839-1210 is the number. 855-839-1210. Our show is Health Watch every Sunday, 8 till 9. Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor and executive director and founder of Innovative Medical Associates. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. We're back here on Health Watch. Operator standing by right now at Innovative Medical Associates. And just because it's Mother's Day, what do you think? They're going home at 9 o'clock? No, they're going to be there. They'll be there all day if you like. 856-489-0505. 856-489-0505. That's the number. Innovative Medical Associates, Marlton, New Jersey. You want to call today? Fine. If not, you want to call tomorrow? That's the same number, 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And don't forget, we have our Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. Got a couple of minutes left of the show. You still have time to jump in with a question or a medical challenge you want to run by Dr. Molly, 855-839-1210. 855-839-1210. Wanted to talk about, Dr. Molly, autoimmune. Is that more of an issue for women than it is for men?
In many cases, it is. Certain autoimmune diseases like scleroderma, which is an abnormal growth of the connective tissue in the skin and blood vessels. And these women have, unfortunately, quite a problem. And again, that affects more women than men, and we have a hydration protocol for that. And again, we have to look at this condition. People sometimes miss it, but there are specific blood tests that can show us. And unfortunately, this really is a tough condition because many people have a problem with this and actually have a shortened lifespan for it.
So let's talk about also in the IVs.
Yes.
You mentioned chelation, and that's kind of
That's just some of the things.
some of the things. But
Right.
what
So
what is in it? What are the things that are in it
bottom-
that's key?
Bottom line is anything that really works on the mitochondria that absolutely will diminish inflammation will help with most autoimmune. For example, we have a patient, a young woman patient who's wonderful, who's been following a very clean diet from a nutritionist that refers to us and been doing very well. She has psoriasis. And when you look at her, you almost could see some estrogen dominance. You can almost see that she's out of balance in her estrogens. So we've been treating her with an IV that helps actually rheumatoid arthritis as well, because psoriasis can be a form of arthritis that affects not just the skin, but affects joints and things like that. So in her case, she's been doing very well. She's on her 20th treatment, and I'll tell you, we've got a situation where we've seen about 30% improvement. And when you think about this condition, psoriasis, you realize it's deep, it's patchy, right? In other words, the new skin growth is operating at such a level that it's coming to the surface too quickly and piling up. That's what psoriasis is. So again, it's an inflammation disorder. So we're looking at her and we're thinking about possibly using my doc will make that call finally about using some bioidentical hormones on this, as well as the IV therapy, which is absolutely unequivocally helping, and her diet. Again, back to lifestyle, right, John? Got to use it. Rheumatoid arthritis in and of itself. How about MS? MS affects more women than men, and as you know, one of my physicians has MS, and she's doing pretty well. And again, we're using things that improve mitochondria function that also can improve the cell signaling between her nerves and muscle. So in her IV, for example, we're using things like beta glucan. There's so many things I use in each of these IVs. It's hard to
take up the whole show talking about it, right?
One day I can give people a list of everything that we have that's made special for us. But, I think that would take up too much of the show. So, and again, the GI tract, how about all the people that come to me, women come to me with more celiac than men. So, of course, that's a dietary change. But also, we use a subclinical dose of a particular pharmaceutical as well as the nutraceuticals to improve the lining in the gut. And again, that's a very, very important point, because the lining of the gut has a lot of cells and receptors, and also has hormones. So guess what? We got to look at that. How about when we look at overall thyroid issues? And I can tell you in the past 7 months or so, I'm seeing an increase in women who not only have hypothyroid, but also have overthyroid, which means Graves' disease. And so they have a metabolic problem that has to be treated differently. So it's such a complex issue. Women are complex, John, not smarter. I'm not saying smarter, although in our clinic we believe so.
Okay.
But that's just a pure belief. It isn't based in science. Okay. But it is true that we see, and again, as women age, we worry so much about the decline in the progesterone levels and the relationship between estrogen and that. And of course, I have a very large share of breast cancer patients.
Yeah, you do. Yeah.
And so there you go. And we know that's extremely important to support them through whatever way they choose to go in terms of their
Let me ask you,
therapy.
you've talked about a lot of different things today on the show. Do women, and you've often said about treatments, 10, 20, 30 treatments, you've given out those numbers in general.
Mm-hmm. Yes.
Do women need more treatments than men?
I'm not going to say that, but I'm going to say comparable treatments than men, depending on really what we're doing. The hormone replacement for women, generally it's between 5 and 10 treatments to tune up the mitochondria, get them on the bioidenticals, and then it's a visit once a month to come back, possibly get some more hydration, and tweak the hormonal recipe. One of my docs has a thyroid protocol that includes coming in for some hydration and also then absolutely seeing her once a month in order to tweak the thyroid issues, because again, that has to do with weight gain and other things. We have a wonderful program for both men and women for weight loss that includes hydration and also some shots to help augment the hormonal issues and get you back in shape. And I would say that the bioidenticals are very important in the weight loss program for men and women.
So there's so many things. I mean, you've really filled us up with so much information today here on the show about.
It's an overview. I wish I could go into a lot of depth, but you know what, guys? We don't need to do that. Just research. My patients are so smart, John. They come in with an armful of research. Some of it good, and some of it Dr. Google. And you just want to toss that out, right? Yeah. But I think the most important thing is, again, women should take charge of their health. And one other thing I want to say, listen, we all have to get together and make sure that the FDA, we should join the Alliance of Natural Health. If you want to see more natural products, I say join the Alliance of Natural Health. I have no vested interest in this. This is a group of people who are like-minded who want to see bioidentical hormone therapy around for a long time and our compounding pharmacists around for a long time. And I would say always come in and see advocates like myself and my physicians when you want to do things like bioidenticals, so that if we're not doing them for you, at least we get an idea of what you are doing and we want to enhance it.
When you say join that, it's, I guess, strength in numbers, right?
Right. It's a trade group. Actually, it's not. I guess it's a group that really advocates for natural health, and that's what I want to say. I guess it's a lobbying group, because gosh knows we need that, particularly with all the new pharmaceuticals that are coming out.
You know, until I met you, I didn't know any of these things. You know, I know. You've given us an education.
Well, and there are a lot of physicians out there, folks, who know about this. Believe me. And the question is, are they set up to do these kinds of things? You know, we have a very unique facility, and I'm proud of it. And I'm proud of the physicians who work with us, the nurses, and everyone.
We have a call real quick. Yeah, let's take her, Jim. Lana and Cape May. Lana, good morning. Welcome and happy Mother's Day.
Happy Mother's Day.
Thank you. That's why I called. Good morning, Dr. Molly and
hey,
John.
Babe.
Listen, Dr. Ma, there isn't a problem that I haven't come to Dr. Molly and her wonderful staff.
Aren't you the nicest?
So, honestly, you are everyone's mother, Dr. Molly.
Thank you.
You are a blessing beyond my words, and I know where the kind of blessings come from you. I had prayed and prayed about my health, and
God
there
bless
you were, 12:10 talk on Sunday morning.
Well, listen, Lana, I want everybody to know you're one of the smartest nurses I've ever met, and you've been doing it for a little bit of, you know, you're a seasoned nurse. I have to watch my words, right? Because, you know, Barbara too gets me. You guys are seasoned nurses, and God knows you've been mothers to many, many people, and thank God, mothering takes on a whole lot of different roles. Thank you.
And Lana said there's a problem you didn't solve. When she comes in, if there's nobody to watch her dog, we watch the dog.
We watch the dog too. What the heck? God bless you guys. Best to your husband, honey.
You.
God bless you.
All right, Lana, thanks for the call.
Thank you.
And happy Mother's Day.
Happy Mother's Day.
All right, and guess what? That is
Shows up.
that is going to put the wraps on another edition of Health Watch. Don't forget, operators standing by at Innovative Medical, and they'll be there well after we leave you at 9 o'clock. 856-489-0505. 856-489-0505, and the website innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of the show, we have a replay, our Health Watch replay, this afternoon and every Sunday afternoon from 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, Joanne, fabulous Fran, and our nurses Jess and Crystal, and our medical assistant, Chatty Cathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week. Happy Mother's Day. Enjoy the day. We'll do it all over again next Sunday. Health Watch 8 till 9. Talk Radio 1210, WPHT. You take care.
This program is a paid commercial announcement and in no way represents